Pigmentation disorders are the conditions that affect the color of skin resulting from the alteration in the melanin production, distribution, and the degradation. Types of pigmentation disorder: hyperpigmentation, increased melanin production, melasma, symmetrical, patchy brown hyperpigmentation on the sun exposed area, face, triggered by the UV exposure, pregnancy, plasma, or the oral contraceptives. Post-inflammatory hyperpigmentation follows the skin injury, lichen, eczema, burns. Appear as a darkened areas in the affected region. Drug-induced antimalarial, amiodarone, tetracycline, and the chemotherapy drugs. Endocrine causes: Addison's disease, generalized hyperpigmentation accentuated in the creases and thumbs. Hyperpigmentation, decreased or the absent melanin production, vitiligo. Autoimmune destruction of the melanocytes, depigmented, well demarcated patches, common on the face, hands, and the joints, associated with the other immune disease like thyroiditis and the diabetes. Albinism, genetic disorders affecting the melanin synthesis, reduced pigments in the skin, hair, and eyes, increased risk of the skin cancer. Post-inflammatory hyperpigmentation follows the injury or the inflammation. Psoriasis, atopic dermatitis, a temporary or the permanent. Mixed pigmentation disorder, bleach and planus pigmentosus. Brownish gray patches affects the sun exposed in the flexural areas. Ashy dermatitis, diffuse ashy gray hyperpigmentation. Nevus of ODA ITO. Unilateral blue-brown pigmentation due to the dermal melanocytosis. Pathogenesis, hyperpigmentation, UV-induced melanocyte stimulation, hormonal changes or the inflammation leading to the melanin overproduction. Hyperpigmentation, loss of the melanocytes or the defective melanin production. Diagnosis, clinical history and the examination, with some differentiates the epidermal versus dermal pigmentation. Biopsy for the uncertain cases, lichen planus pigmentosus. Blood test, rule out the associated condition like thyroid dysfunction and the vitiligo. Management, hyperpigmentation, topical agents like hydroquinone, azelaic acid, kojic acid, and the retinoids. Procedure, chemical peels and laser, target melanin deposits. Prevention, sun protection with a broad spectrum sunscreen. Hyperpigmentation, topical therapies, corticosteroids, calcineurin inhibitors for the vitiligo. Phototherapy, narrowband UVB, excimer laser for the vitiligo. Surgical options, melanocyte transfer in the stable vitiligo. Supportive care, cosmetics for the camouflage. General measure, sun protection to prevent the exacerbation of the pigmentary changes. Psychological support for the visible pigmentary disorder. Melasma, triggered by the UV exposure, treated by the sun protection and the depigmenting agents. PAH, common after the acne, avoid the skin trauma to prevent the recurrence. Vitiligo, autoimmune destruction of the melanocyte, treated with the steroids and the phototherapy. Addison's disease, generalized hyperpigmentation, especially in the mucosal sites. Albinism, genetic, involves the complete or the partial absence of the melanin, increased cancer risk. Good slump, useful for diagnosing the epidermal versus dermal pigmentation. Nevus of OTA, blue-brown pigmentation in the trigeminal nerve distribution. Treatment focus, depigmenting agent for the hyperpigmentation, depigmentation or the camouflage for the hyperpigmentation. Sun protection, essential in managing the all pigmentation disorder.